You think you know the biggest risk from heavy drinking? Think again. We're about to dive into a massive study that uncovered a hidden danger, a common condition that can nearly double the risk of severe liver disease for people struggling with alcohol. And honestly, it points to a huge blind spot in how we think about healthcare.
So here's the central question. When someone walks into a clinic and says, "I need help with my drinking," what are their real odds? What's their actual risk of getting seriously ill or even dying over the next 10 years? For a long time, doctors knew the risk was high, but they didn't have the hard numbers. Well, that's all about to change.
Okay, here's our roadmap. We'll start with that big question, then we'll look at the incredible study that found the answer. We're going to uncover a pretty shocking mortality gap, then zoom in on the liver, and then we'll get to the big twist, this risk multiplier that was kind of hiding in plain sight. And finally, we'll talk about what it all means.
Right. So here was the problem for doctors. They knew heavy drinking was bad, of course, but what they were missing was the absolute risk. It's the difference between telling a patient this is dangerous versus telling them you have a 1 in 10 shot of this happening. And having that specific number, it's absolutely crucial for figuring out who needs the most urgent help.
And just so we're all on the same page here, we're talking about something called alcohol use disorder, or AUD. This is more than just having a few drinks after work. It's a pattern that causes real, measurable harm to someone's life and health. And it's a huge deal globally, affecting more than 5% of the entire world population.
So that brings us to the hero of our story, this absolutely incredible, massive study out of Denmark. What they did was use the country's national health records to follow literally every single person who got public treatment for AUD over a 12-year span. It gave them a data set of a scale and power that we've just never seen before. Here's how they set it up. It was actually pretty simple. They had two big groups. Group 1 was everybody entering treatment for alcohol use disorder. Group 2 was a huge comparison group from the general public, all carefully matched up by age and sex. The idea was to see exactly how the risks compared.
And when I say the scale was huge, I mean, wow, look at this. We're talking about almost 48,000 people in the AUD group, and they compared them to nearly 500,000 people from the general population. With that kind of statistical power, you know the results are going to be solid.
So, the big question, what did they find? Well, when the researchers looked at these two groups over a 10-year period, the very first thing that jumped out was just a staggering difference in who survived. This visual really tells the whole story, doesn't it? On the left, you see this huge pileup of different causes of death for the AUD group. On the right, for the general population, it's so much smaller. This wasn't just a slight increase in risk. It was a massive, across-the-board danger.
Let's put a number on it because it's a big one. After 10 years, the risk of dying from any cause was 4 times higher for people who had gotten treatment for AUD compared to their peers. 4 times. Just let that sink in for a second.
And to make that even more real, check out the actual percentages. Over that decade, almost 18% of the AUD group passed away. That's nearly 1 in 5. Compare that to the general population, where it was only 4.5%. The gap is just enormous. So you have to ask, where is this huge difference coming from? Well, the study found that about half of all those extra deaths were from things you might expect, either directly alcohol-related causes, like liver failure, or from what are called external causes, things like accidents, injuries, and suicide, which we know are also tightly linked to AUD.
Okay, so the overall risk of dying is huge, but the researchers wanted to zoom in on the one thing everyone associates with heavy drinking: the liver. They wanted to finally put a hard number on that specific danger.
And here's the number they landed on. For the average person starting AUD treatment, there's a 7.1% chance they will get diagnosed with alcohol-related liver disease sometime in the next 10 years. So about 1 person out of every 14. That's a serious risk, no question. But that's not where the story ends.
Because this is where things get really surprising. As the researchers dug into the data, they found something else. Another factor that acted like a powerful risk multiplier, just cranking up the odds of liver disease. And it turned out to be a super common condition that millions of people already have.
Okay, take a close look at this graph because this is the absolute heart of the discovery. That bottom line shows the risk for your average AUD patient. That's our 7.1% baseline. But look at that top line. See how it just breaks away and shoots up so much higher? That line is the people in AUD treatment who also have type 2 diabetes.
For that group, the 10-year risk of getting alcohol-related liver disease absolutely skyrockets to a staggering 13.3%.
Let's just put those numbers side by side, because this is the big aha moment. Without diabetes, the risk is 7%. With type 2 diabetes, it jumps to over 13%. Having both conditions literally almost doubles your risk of severe liver disease. It's like this dangerous combination of alcohol and metabolic problems.
So what on earth do we do with this information? I mean, these aren't just numbers on a chart. They are a clear, urgent call to action to rethink how we care for people who are dealing with both of these issues at the same time.
So let's just quickly recap the bombshells here. People seeking help for AUD have a 4 times higher risk of death, period. Their baseline risk of liver disease is about 7% in 10 years. But, and this is the game changer, if that person also has type 2 diabetes, their risk shoots up to over 13%. It almost doubles.
You know, the study authors really said it best themselves. This discovery means that doctors who treat diabetes need to be asking about alcohol, and doctors who treat alcohol problems need to be screening for diabetes and checking the liver. You just can't treat these things in separate boxes anymore.
And that really leaves us with one final and I think really important question. This study shows so clearly how two different health problems can crash into each other and create a much bigger danger. So it makes you wonder, how can we build a healthcare system that actually sees the whole person, that connects the dots between these things before the worst happens?